BCG vaccination. It is intradermal, the Bacillus Calmette Guérin inoculation. So normally what happens? There is a papule by 2 weeks, which ulcerates by 2 to 4 weeks, something, and ulceration usually heals gradually by 2 to 4 months. This is the normal BCG vaccination, like that is you get a scar usually, but occasionally it may not happen. So there can be delayed reactivation by when there is COVID-19 vaccination, influenza vaccination, or in a very rare disease, multisystem inflammatory syndrome in children, as you see in the many of the inflammatory conditions, GIA, lupus, and others. So it's a dreadful disease. So severe sort of infection and immune process throughout the body, inflammatory process. Also in influenza vaccination, it is being influenced. KDA, Kawasaki disease, also influences the reactivation. There is delayed in immune interaction between the two BCG and these diseases. So and this and COVID vaccine, COVID-19 cases. So thereby there can be little bit delayed reaction. Occasionally, it can have other complications like regional lymphadenitis, subcutaneous abscess formation, scleroderma, and lupus vulgaris-like presentation. Very rarely, you have skin reaction that has tuberculosis histology without mycobacterium tuberculosis in its center or in anywhere of it. Usually, there is history of previous tuberculosis in those cases, and they have recurrent sort of crops, asymptomatic cases also possible, which may produce papule, ulcerate, with depressed scar and plaque formation. So called lichen scrofulosa Dharma sort of presentation, and they usually these cases are being given antitubercular. They respond well with antitubercular by for 2 weeks or so. Give in standard fashion for 6 weeks or so, 6 months or so.